In this video, we'll talk about the different forms in which drugs are available, and we generally call them dosage forms. When we talk about dosage form, it is, a form because a drug could be available as a tablet, as a solution, as an injection. All these different forms are referred as dosage forms. And you might wonder why really drugs exist in such a different form. It's for many reasons. For example, if you take children prefer a solution. So we have drugs in solution form. In case of emergency condition, it's very best to give medicines in an injectable way. So we have different types of dosage forms. I'll talk to each one of them in the next videos. In this series, we'll talk about each of them and the difference. How should we take it as a client, as professionals? How should we best advise our clients who are taking all the different dosage forms? That is what I will be talking in this series. So the first category of dosage form, we call them the solid dosage forms, like the tablets, the capsules, the powders. We have also the granules. We also have the liquid dosage form. Basically, liquid dosage forms, as the name implies, they are liquids. We have syrups, we have suspensions, we have elixirs. Quite a number. We also have semi-solid dosage forms like creams, lotions, ointments. We also have pastes with gels. We also have drugs in the form of inhalation in a gaseous form, where there are some drugs which can be given directly through the nose or the mouth as a nasal spray or as inhalation, especially those for treatment of asthma. Even we could have inhalational anesthetics. So allow me in the next episodes to dissect each one of them in a bit detail. In this video, let's start talking on the solid dosage forms. And as I mentioned in the earlier video, the solid dosage forms, as the name implies, they are really solid. They are like the tablets, the capsules, powders, and granules. They are solids. Some of them are meant to be swallowed, like the tablets and capsules, while the powders, granules, you're expected to dissolve them in water before taking or swallowing them. And most of these solid dosage forms are taken orally. They are not for injection or not for ointment. In the next video, I'll talk about each one of the solid dosage forms. In this video, let's talk about tablets. Maybe let me pause and take 1-2 seconds to tell me some of the tablets you've taken in the last 1 week. Which tablets? Paracetamol tablet. Maybe an antibiotic tablets like amoxicillin, or amoxicillin is usually in capsule form. I don't know, which tablet have you been taking? Maybe ibuprofen, diclofenac, metformin tablet. Okay, your antihypertensive. So we have quite a number of preparations or drugs in the form of tablet. Basically, tablets are compressed, and this is a very important point to know. In any dosage form, we have an active ingredient and an additive. Consider your meat stew. In meat stew, you have the real meat and you have all the other sauces, the onions, the tomatoes, the pepper, the oil. Many things are added, and you see, you are not eating just to eat the tomato or the sauce. You are there to eat really the meat. That you see. So the real ingredients in dosage forms that will treat the illness are referred as the active ingredients. But we also have some additives that will make the drug a drug to be stable. You can have some additives to give the dosage form a good stability, to stay for some time, to dissolve in the stomach, and the like. So tablets are a compressed dosage forms. All these ingredients are compressed in a certain shape, be it oval, be it circular, different shapes of tablets. So basically, tablets are meant to be swallowed as is. Unless it's advised for you to chew in some specific tablets, tablets are meant to be swallowed. It's very important not to chew your tablet. Some people usually chew or dissolve their tablets in water. before they swallow. That is not good because some tablets could be coated to prevent GI irritation. So the moment you chew, the moment you dissolve, you are removing that coat and there may be GI irritation. Some tablets are also designed in a way or coated to work slowly, to be released slowly. We call them slow release tablets. Again, if you crush them, you will lose that benefit. So what is the home tech message? Tablets are among the most common medicines usually given to patients. And when you're given tablets, keep the following things. Number one, swallow with water, not with coffee, not with alcohol, not with milk. All those things could affect how the tablet will dissolve. The other thing is don't crush, as I mentioned earlier, because you will lose the effectiveness of your tablet. Other solid dosage forms are capsules. Those with red and black color, and you can see it here in the picture. These capsules, unlike tablets, all the ingredients, you find them mixed and they will be kept in the capsule shell. The capsule shell has two components. That red and black thing, maybe it's called the cap and the body. So everything is there in the body. Okay, they are not compressed. So here is the catch. The same way I said, do not crush your tablet. Do not break down or chew the tablet. The same is true for capsules. It is not advised to open the capsule and dissolve in water. Unless you're advised, that is not a good and a correct way to take your capsule. Capsules are solid dosage forms. I know some people really struggle to swallow capsules, but they should be taken as is. And sometimes one of the easy things you can do is maybe drink a sip of water and then try to swallow. Don't try to do any other funny thing. I've seen some people doing, trying to nod their head before they swallow. All those will not really help and is not also the right way. So consult your healthcare professional on the right way, on how right to take a capsule. So tablets, capsules, these are solid dosage forms and very important. They are among the common ones. Take, for example, amoxicillin, ampicillin, azithromycin. We have quite a number of medicines given as either a tablet or a capsule form. So the big thing is to take them as is advised. And also health professionals, we need really to educate people on the correct modality of taking tablets, taking capsules. We should really explain that step in a simple language in which patients really understand. In the next video, I'll talk about powders and granules. See you.